Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspectives and insights within the field of otolaryngology. I'm your host, Rahul Shah. In this episode, I talk with Dr. Shreya Mandava at the November 2024 American Medical Association House of Delegates meeting about how she has found a passion for advocacy in her journey to otolaryngology and how we can each make a difference, no matter what stage of career. Dr. Mandava is a PGY1 resident at the University of Michigan and is our section for residents and fellow in training delegate to the AMA House of Delegates. Watch and listen for more about the important work in the area of advocacy and how you can get involved. Dr. Mandava, thanks for being here with this.
Absolutely. We are at the American Medical Association Interim Meeting 2024. We are in Orlando, Florida.
Awesome. And where are you in your otolaryngology career?
So I am a PGY1. So I'm about 4 months into residency.
Oh my gosh, I can't believe it. What's been your best rotation so far?
Definitely pediatric otolaryngology.
Of course, you're just saying that because I'm a peds oto. But
I promise. So it was my second month actually, and my first month I'd started on an ICU rotation. Wasn't really able to do much oto, but then I went into peds, and it felt like all of a sudden there I was getting a lot of surgical experience, doing tonsils, adenoids, just diving right into it, which was awesome.
Great for you. And where are you in training, just for our listeners to know?
I'm at the University of Michigan in Ann Arbor.
So Shreya, you are not originally from Michigan. Where did you do your medical school?
I went to the University of Virginia for medical school.
Wow. Why otolaryngology?
I first had to figure out, did I want to do something medical or surgical? And I didn't come into med school knowing I wanted to do surgery, but figured it out pretty quickly. I loved the operating room, loved seeing direct results of our work on patients quickly. And then within surgery, I was just extremely attracted to head and neck anatomy, and I liked the patient populations we work with.
Yeah, I'm so excited that you were here representing a group, and you're going to tell us about that at our Otolaryngology Section Council this morning. Who do you represent?
So I am currently the resident and fellow section delegate to the American Medical Association for the Academy.
So what does that mean?
So our academy is represented at the overall American Medical Association, and our delegation advocates for the needs of our otolaryngology physician members. And so I am one of the two residents and fellows that are appointed to serve as representation on the delegation.
Where did your journey with organized medicine start? Where did this passion come from?
So it started in medical school, actually. And so I had done a lot of health advocacy work as early as undergrad, mainly more so peer health advocacy. So I came into medical school knowing I had this interest in health policy, but I didn't know exactly how to explore that. I wasn't even aware of organized medicine when I first started medical school. And it's interesting, I did not know about the AMA at first, and it was one of my classmates in medical school who had gotten involved with the AMA and our state medical society that came up to me because the AMA annual meeting was coming up, and she said, I don't really want to go to this, but you seem very excited about advocating for patients and health policy. You should go to this instead. And so I went to my first annual meeting and absolutely fell in love. I really loved the discussions that took place at the AMA meeting. And from there, I continued to take on more leadership positions, write resolutions, get involved.
I was impressed this morning. You raised your hand and you suggested a change, and we all agreed with you. Inspire some of your co-residents and co-fellows, and can you make a difference?
You absolutely can make a difference, and that is one of the biggest things I've learned from my work in organized medicine and advocacy is you can be at any level in your training, and if you have the courage to speak up, you can make a difference. One of the most impactful moments for me was actually in medical school. I wrote a resolution for our state medical society, the Medical Society of Virginia, advocating for the health needs of LGBTQ+ individuals, specifically transgender individuals, because we had no policy on that at all. And shortly after I had helped write and pass that policy, there was a wave of anti-gender affirming care legislation introduced at the state level. So me as a, very green first or second year medical student, writing that resolution then gave our medical society the, power to lobby on that topic.
That's great. You're a PGY1.
Yep.
As a PGY1, your time is very busy. What do you like to do in your free time?
I enjoy the free time that I do have. So I'm a big spin cycler. I love spin classes, but I invested in a Peloton recently, which I'm very excited about. I love to read. I'm a big audiobook person in particular, love to listen, then I can multitask, cooking, cleaning. I love thrifting. That's one of my more creative hobbies. And I like traveling and hiking as well.
What excites you about otolaryngology and your career ahead? You are our future. You're our most valuable members, the group you represent. What excites you?
I think we have a field that there is so much innovation. And I think just with the advances we're seeing in technology and AI, I think we're going to see a lot of growth in our field, and I think we're going to have to adapt a lot, which excites me. That's something I knew about myself going into medicine. I didn't know what specialty I wanted to do, but I knew I wanted to be on the cutting edge, and I wanted to be someone that is able to anticipate and adapt to the changes affecting healthcare in our field.
One of my platforms is to advocate, innovate, and collaborate. And It's really interesting because you're here advocating, You're talking about innovation, and together you and I are collaborating to move medicine forward. So awesome that you share those same ethos.
Yes, absolutely.
On a down note, what scares you about the future of medicine, surgery, otolaryngology? Or intimidates you or keeps you up at night?
I think that's a great question. One policy passion and interest I have is actually health worker, physician, and trainee well-being. It's something I developed an interest in medical school. I got involved with the Dr. Lerner Breen Heroes Foundation, but the topic of health worker burnout, I think, is something that is going to continue to plague us in future years. I think especially in regard to the way health systems are set up as far as consolidation that's happening, electronic health records, and transitioning to value-based care, the increased administrative burden on physicians and surgeons. I think these are all topics that are going to continue to face us, and I think my generation will have to deal with a lot of that.
I'm confident with people of your intellect and passion will find a win-win for our patients and our doctors. Yes. Are you optimistic?
I am definitely optimistic. I think there is so much to look forward to, even just RefComB, which I was in right now. We were discussing a resolution, a report on generative AI and the role that's going to play in healthcare. And it's interesting to think about because I think there's so much potential that it's something that could help both patients and physicians, but we have to make sure that it's being done the right way. And I think that's where advocacy comes in. That's where the AMA comes in.
So if I put a magic wand in your hand and you could wave it over the academy, what could I do for you?
What could you do for me?
And how about those you represent, residents, fellows, perhaps prioritizing well-being, engagement, increasing opportunities?
I think having that line of communication and listening to us, listening to our concerns, I think as a resident and fellow, our biggest topic of interest likely is the well-being and and also I think making sure that I've heard subjectively that the transition from being a trainee to an early career physician is incredibly difficult. It's not something I've thought about a lot since I'm so, young, but I think equipping our trainees to handle that transition, make sure they're supported, have the resources they need, is going to be very helpful.
Dr. Mandava, that's such an astute point. I remember that transition is very difficult. Going from a fellow where you had camaraderie and a huge team rounding with you to the loneliness of being an attending. And I was an academic attending. I was surrounded by peers, but it's a big change.
Yes.
It is a big change. I'm excited that you feel you have a voice. And I think it's very meaningful when we talk about the voices of otolaryngology, which is our podcast series that we have a line of communication, myself as the EVP and CEO and you as a PGY1. It's really exciting that we're both together joined in our initiatives to advocate, innovate, and collaborate.
Absolutely.
What message do you send to PGY1s, 2, 3, 4, 5s out there, the residents and fellows? What message shall we send to them?
My message is it's never too early or too late to get involved. I did not know about organized medicine, the AMA, the academy, starting medical school, but it has played such an important role in my training. And I would just encourage all of you, if you have any sort of thought or opinion, to get engaged and make your voice heard. I think we have a duty as trainees and physicians to make sure that we're advocating not just for ourselves, but our whole field and our patients.
Love that open line of communication when I think of voices of otolaryngology, we are not shy and we don't have a lack of opinions and thoughts. Is it okay if residents, fellows, other members reach out to you?
Absolutely. Yes, I'm happy to talk to anybody about my experiences, help them get more involved.
And remind us again, where are you in training? What year are you? What program are you with?
I am a PGY1 at the University of Michigan in Ann Arbor.
I am forever grateful for our mentors and the shoulders that we stand on, those giants.
Yes.
Who are some of those mentors for you?
Yeah, I've had some incredible mentors during medical school in particular. Dr. Sam Oyer at UVA, Dr. Jim De Niro, Dr. Park. They were all instrumental in helping getting me engaged and involved with the field.
So without them, you might not be an otolaryngologist.
No, absolutely not. I think, if it weren't for those early shadowing and research experiences, I definitely would not have chosen this field. And the people was part of it for me too.
Well, I have a feeling you pay it forward.
I will, absolutely.
I think you probably already do. You probably mentor those below you.
Yeah, I do my best. I think, we all could use that sort of support and mentorship.
Well, on behalf of Academy members, we're thankful for the time that you're spending a long weekend here advocating for members. Any last comments, thoughts, anything you want to tell us? Are you Commanders fan?
I am a Commanders fan.
Because you're a native of Virginia.
Yes, I am.
But you were going to say but you're surprised they're winning?
Well, I just wanted to say I'm getting very excited about Michigan football.
Okay. All right. So you're a convert over there.
Yeah, I just might be a Midwest convert.
You have 5 years there.
Yep.
Dr. Mandava, as we wrap up here, thank you. I pulled you out of Reference Committee B. Any final comments for our members?
I would just encourage all of you at any level to be engaged, make your voice heard, and just try to educate yourself about how many resources there are available to you through our academy.
And I would say it's perhaps selfish because we want to make sure your 40, 50-year career is as awesome as it can be. So together, our voices can be heard.
Yes. Yeah, it's very cheesy, but I tell myself, we are the future. So.
Yes, but you are the future, and you're here advocating. It's admirable to see you here, and we're forever grateful. Thank you, Dr. Mandava.
Thank you.